Imagine peering deep inside the human body, seeing organs, tissues, all in full 3D.
And updating in real time.
Right, real time. And crucially, without any harmful radiation. For ages, that felt like, well, science fiction almost.
Pretty much.
Welcome to the Deep Dive. Today we're looking at a source that suggests maybe that future isn't so far off. We're doing a deep dive based on this pretty detailed report about something called DISP.
Right, DISP. Deep imaging with spatial phase and frequency control. Bit of a mouthful.
It is. The report itself, Deep Ultrasound Tissue Imaging. A diagnostic frontier. It's dense, aimed at researchers, medical pros, you know.
Yeah, lots of technical detail in there.
So our mission today, we're going to be your guides. We'll pull out the really important stuff, the surprising bit.
The key takeaways.
Exactly. Give you a shortcut to understanding what this tech is and what it might actually mean for medicine down the line.
Sounds good.
Okay, so setting the scene a bit. We all know traditional ultrasound, right? It's been a medical workhorse forever.
Absolutely. Super valuable.
Because it's safe.
Yeah.
No ionizing radiation like X-rays or CTs.
A big plus.
And you get those real-time views. It's pretty cost-effective, accessible.
All true. But it has had limitations.
Right. That's the thing. Seeing really deep, especially in larger patients.
Yeah, penetration can be an issue.
And getting sharp images way down deep, that resolution drop-off. Plus, it's mostly been looking at the body slice by slice, 2D views.
And that's precisely the gap this report argues DISP is built to bridge. It's framed as a real transformation.
So not just tweaking the old stuff.
No, it seems more fundamental, taking ultrasound principles, but pushing them way further with these new techniques.
Okay.
The goal is getting into that high-fidelity 3D volume imaging territory, specifically being able to reach and clearly see those deep tissues traditional ultrasound struggled with.
So bridging the gap between, say, regular ultrasound and maybe MRI or CT, but without the radiation.
That seems to be the positioning, yeah. A leap forward, according to this source.
Okay, let's unpack DISP then. What are the actual, technological pillars making this deep 3D imaging happen?
Yeah.
Because, like you said, it's not the old ultrasound machines.
Right. The report really highlights three core foundations working together. There's frequency control, phase control, and then these advanced volume imaging techniques.
Got it. Three pieces. Let's start with frequency control. I kind of get the basics there.
Yeah.
The usual trade-off.
Exactly. High frequencies, maybe 7 to 20 megahertz, great resolution, sharp pictures.
But shallow, like skin, eyes, stuff near the surface.
Perfect. And then low frequencies, down around 1 to 5 megahertz, they go much deeper right into the abdomen.
But the picture gets fuzzier. Lower resolution. That's the compromise.
That was the compromise. And this is where the report says DISP changes the game.
Ah. How?
Well, instead of just picking one frequency and being stuck with it, these systems can dynamically switch frequencies during the scan.
Switch, or you said blend them?
Yeah, or even blend them. The idea is to optimize the sound waves for different depths almost simultaneously.
So you can build up that 3D picture layer by layer, using the best frequency for each depth.
That's the core concept. The report even breaks down specific bands they use, like 10, 20 megahertz for the very superficial stuff.
Okay.
Then maybe 5, 12 megahertz for thyroid, muscles, joints, that sort of mid-range depth.
Right.
Then 2 to 5 megahertz for deeper things like the abdomen or an OBGYN scans.
Makes sense.
For the heart or fetal imaging, maybe 2 to 7 megahertz, you need the penetration and you need to handle the motion.
Ah, good point. Motion's key there.
And then for the really deep organs like liver, kidneys, maybe deep tumors, they can go down to 1.3 megahertz. But, and this is critical, they combine that low frequency with very precise phase focusing.
Okay, so that segues perfectly into phase control. What exactly is that and how does it help?
So phase control is all about precisely shaping and steering the sound beam. It uses these special probes called phased array transducers.
Phased array, meaning lots of little elements.
Exactly. Hundreds, sometimes thousands of tiny individual transducer elements on the probe face. And the system can control the timing, the phase, and the strength, the amplitude of the sound waves sent out by each of those tiny elements, just slightly differently.
Okay. And what does that let you do?
It lets you electronically steer the sound beam. You can focus it, make it narrower, point it in different directions, all without physically moving the probe.
Ah, so you're focusing the sound energy.
Precisely. You can create a really tight, focused beam and aim it exactly where you need it, even deep inside the body.
And why is that so useful?
Well, it means you can target specific tissues much better. It also helps reduce acoustic noise, random echoes bouncing back from places you don't want to see.
Planar signal?
Right. Which gives you the cleaner data you need to build those really detailed 3D tissue maps. Think of it like having a laser pointer instead of a broad flashlight beam.
Gotcha. Okay, so dynamic frequency for depth, phase control for steering and focus. How do you put it all together to get the full 3D volume, not just a slice?
Good question. That's where the volume imaging techniques come in. And there are a few ways they do this, according to the report.
Like what?
Well, one way is hardware, using what they call matrix array transducers. Instead of just a line of elements, it's a 2D grid, like pixels on a screen.
So the probe itself is built to see in 3D.
Essentially, yes, it can capture a whole chunk of volume data in one go.
Okay, what else?
Then there are more processing-heavy techniques, like synthetic aperture imaging or SAI.
Synthetic aperture. Sounds complex.
It sort of is. The idea is you combine data gathered from multiple different angles or positions.
Ah, like stitching photos together.
Kind of, yeah. You synthesize a larger, clearer view, a high-resolution image across a wider area or volume by combining these different perspectives.
Oh.
Builds up the 3D picture.
Okay, makes sense. Any others?
Yes, and one the report really emphasizes for its speed is plane wave imaging.
Plane wave. How's it that different?
So traditional ultrasound usually sends out a narrow, focused beam and sweeps it across the area.
Right, line by line.
Plane wave imaging does something different. It sends out broad, unfocused wavefronts, like planes of sound that cover a large area all at once.
A whole wide beam instead of a narrow one.
Exactly. And then it listens back for all the echoes coming from that whole area simultaneously.
And that's where the speed comes in. I remember reading about ultra-fast acquisition.
Precisely. Because you're illuminating a large area instantly and capturing all the return signals at once, you can achieve incredibly high frame rates. The report mentions numbers like around 10,000 frames per second.
10,000. Compared to traditional, what is traditional, like 30, 60 frames?
Something like that, yeah. So it's orders of magnitude faster.
Yep.
And that kind of speed is absolutely critical if you want true real-time 3D, especially for moving things, like you said, a beating heart valve.
Wow. Okay, that's impressive. So you've got the dynamic frequency, the phase control steering, and these volume techniques like matrix arrays or super fast plane wave. Pulling it all together, what's the payoff? Where is this actually being used in medicine now?
Yeah, what does it mean clinically? The report lists quite a few areas where these DISP-type systems are already making inroads or showing real promise.
Okay.
And the key insight seems to be how it enables views or diagnoses that were just really difficult or maybe impossible with older ultrasound tech.
Like where? Give us some examples.
Okay, so cardiology is a big one. Getting really detailed 3D echocardiograms.
Seeing the heart in 3D.
Yeah, visualizing the complex shapes of valves, the heart chambers, measuring volumes accurately, even mapping blood flow patterns in 3 dimensions.
Wow. Seeing valves actually moving in 3D in real time. That must be huge for diagnosis, planning surgery.
Absolutely. Huge implications there. Then there's oncology.
Cancer diagnosis and treatment.
Right. Using it for non-invasive tumor localization, finding the tumor precisely, and importantly, guiding biopsies.
Ah, so helping the needle get to the right spot.
Exactly. Even for deep tumors, like in the liver or pancreas, where hitting the target accurately without using radiation was always a big challenge. Seeing the tumor volume in 3D helps guide the needle much more effectively.
That makes a lot of sense.
What else?
Neurology. This was surprising to me. Using those low-frequency phased arrays we talked about,
Yeah.
they're actually managing to do transcranial 3D imaging, looking through the skull.
Wait, through the skull with ultrasound? I thought that was basically impossible.
It was considered extremely difficult, yeah.
Right.
But they're using these techniques to visualize blood flow in the brain in 3D. That's really pushing the boundaries.
Genuinely new territory then. Okay.
Definitely. Obstetrics and gynecology, OBGYN, is another area benefiting hugely.
Fetal imaging.
Yes, getting detailed views of the fetus, the brain, the spine, heart development, other organs, all in a full 3D volume, gives doctors incredible insight into fetal development and potential issues.
Much more information than a 2D slice.
Much more. Orthopedics, too. Imaging muscles, tendons, ligaments, joints.
Musculoskeletal stuff. Right. Seeing those structures in real-time 3D is really valuable for diagnosing injuries, looking at joint function, planning rehab or surgery, and urology. Things like measuring prostate volume more accurately or, again, guiding biopsies for prostate cancer detection.
So it really is broad, from the brain to the heart, abdomen, pregnancy, joints.
Yeah.
It's touching a lot of different areas.
Yeah, the report suggests it's really extending ultrasound's diagnostic reach across the body.
Okay, so that's the core tech and where it's being applied now. But the report also mentioned emerging innovations,
Yeah.
stuff that's even more cutting edge.
It did. Beyond the core DISP techniques, there are some really exciting developments on the horizon that could push things even further.
This is where it starts to sound like next generation stuff, yeah. What are we talking about?
Well, one thing mentioned is photoacoustic 3D ultrasound.
Photoacoustic, like light and sound together.
Exactly. It combines laser light with ultrasound detection. You shine a very short laser pulse onto the tissue. Certain molecules in the tissue absorb that light energy, heat up slightly, expand, and that creates a tiny acoustic wave, a sound wave.
Which the ultrasound probe then picks up.
Precisely. And the really cool insight here is different molecules absorb different wavelengths of light.
Ah, so you can tell what's there.
Potentially, yes. It allows you to detect molecular signatures, not just the physical structure. So you could, for instance, visualize how much oxygen is in a tumor.
Functional information, not just the shape, but how it's working.
Exactly. Functional information alongside the 3D structural image. It adds this whole other layer of diagnostic data.
Wow. Functional imaging with ultrasound. That's a huge step. Okay, what else?
Well, unsurprisingly, artificial intelligence, AI, it's popping up everywhere.
Of course. How's it helping here?
The report talks about AI reconstruction and denoising, so using machine learning models to clean up the ultrasound signals.
Better pictures.
Yeah, improve the signal-to-noise ratio significantly. Also, making the real-time 3D rendering faster and smoother, and even helping with diagnosis training AI to spot lesions or abnormalities more accurately in those complex 3D volumes.
Right, pattern recognition.
Mm-hmm. And potentially, AI could even reconstruct good 3D images from less data, maybe making scans faster or possible with simpler hardware.
Interesting. Okay, AI photoacoustics. Anything else?
There's also talk of wearable 3D ultrasound arrays.
Wearable. Like
Right.
a patch you stick on.
Basically, yeah. Using flexible electronics to create patches with these mini arrays that could be worn on the skin for continuous monitoring.
Continuous. Of what?
Organs like, say, the bladder, monitoring its fullness, or maybe the heart, tracking its function over time outside of a hospital setting.
Whoa. Real-time monitoring, just wearing a patch.
Yeah.
That could change how we manage certain conditions, right?
Mhm.
Or track recovery after surgery.
Absolutely. Huge potential there for remote patient monitoring.
Okay, this is getting wild. Anything else?
And then there's the really, really experimental stuff. Quantum ultrasound probes.
Quantum. Okay, now you're really blowing my mind. What's the idea there?
So this is leveraging principles from quantum physics, using highly sensitive quantum sensors with the aim of achieving unprecedented sensitivity to the ultrasound signals, especially from deep tissues.
So even better depth and clarity.
That's the hope. And potentially it might allow for good imaging with much less acoustic power being sent into the body.
Which would make it even safer.
Potentially, yes. Which could be really important for sensitive applications like imaging babies or during pregnancy. But, you know, this is still very much in the research lab phase.
Still, quantum ultrasound. It shows where the thinking is headed. Incredible stuff. Okay, so with all these advanced capabilities, it's probably useful to step back and see how DISP actually compares to the other big imaging tools we use.
Yeah, putting it side by side with conventional ultrasound and then with MRI and CT helps clarify its unique strengths and maybe its weaknesses too.
Okay, let's do a quick comparison. What about radiation? That seems key.
Right. Big differentiator. Conventional ultrasound and DISP. Zero ionizing radiation. Big safety advantage. CT scans, on the other hand, use high levels. MRI uses strong magnetic fields, no ionizing radiation, but has its own safety considerations.
Okay, so DISP keeps that core safety benefit. What about how deep it can see?
Conventional ultrasound is generally moderate depth. DISP, because of that dynamic frequency and phase control, achieves high penetration depth, often getting close to what MRI and CT can reach deep inside the body.
Yeah, the picture quality, the resolution and 3D aspect.
So conventional ultrasound is mostly 2D, and like we said, resolution drops off at depth. DISP delivers high-resolution 3D volumetric images. MRI and CT also provide high-res 3D, so DSP is really stepping up into that 3D realm.
Makes sense. Now, practicality, portability and cost, always important.
Definitely. Portability. Conventional ultrasound is often highly portable. You see handheld devices now. MRI, CT, not portable at all. Big fixed machines.
Low portability.
Right. DISP systems. The report puts them as moderate to high portability. They're more complex than basic 2D machines, maybe cart-based, but still way more portable than an MRI scanner.
Okay. And cost?
Similar story, conventional ultrasound is relatively low cost, MRI and CT are high cost. DISP systems land somewhere in the medium cost range, more than basic ultrasound, but less than MRI CT typically.
Right. And the real-time aspect, seeing things live.
Crucial advantage for ultrasound. Both conventional and DSP offer real-time imaging. You see movement, flow, procedures as they happen. MRI is slow, not real-time. CT is faster than MRI, but still only partially real-time, maybe for guiding interventions.
Okay, that comparison really crystallizes it. DISP seems to hit this sweet spot, high-res 3D like MRI CT, but real-time like traditional ultrasound, no radiation, and potentially more portable and cheaper than the big scanners.
That seems to be the unique value proposition. Yeah, it looks designed to fill specific diagnostic gaps where you need that combination of features.
But it's not perfect, right? The report mentioned challenges too.
Absolutely. No technology is a silver bullet. The report does point out several clinical considerations or hurdles.
Like what? What are the downsides or limitations?
Well, even with better penetration, you still run into acoustic shadowing sometimes. Meaning dense things like bone or air pockets like in the lungs or bowel gas can still block or scatter the sound waves. So seeing clearly behind those structures can still be difficult. That's just physics for ultrasound.
Right. Sound doesn't pass through everything equally.
Okay. Then there's operator dependency.
Still needs a skilled person running it.
Yes. While the tech is getting smarter, getting consistently high-quality 3D scans, especially for complex cases, still relies heavily on the skill and training of the sonographer. And standardizing how people acquire and interpret these 3D volumes across different places is still an ongoing process.
Consistency is key. Got it.
Also, data volume. These 3D scans generate a lot more data than 2D slices.
Huge files.
Yeah, which means you need more robust systems for storing that data, processing it, archiving it. That's a practical infrastructure challenge.
Okay.
And finally, with AI becoming more involved in interpretation, there's the whole area of regulation and AI explainability.
Getting approvals and doctors needing to trust the AI.
Exactly. Regulators need to approve these AI tools for clinical use. And doctors need to understand, at least to some degree, how the AI reached its conclusion, especially if it's suggesting a serious diagnosis. Building that trust is crucial.
Makes sense. Okay, so challenges remain. Looking forward then, what did the report say about the market for this tech and where it might be heading in the future?
The market outlook seems pretty strong, according to the numbers cited. The overall global ultrasound market is big business mentioned as over, $8.5 billion in 2024?
Wow.
And expected to grow substantially, maybe over $14 billion by 2030.
Significant growth.
Yeah. And within that, the 3D segment, where DISP plays a major role, is growing particularly fast. The report mentioned a CAGR, compound annual growth rate, of around 10%, driven by demand in those areas we talked about: cardiology, oncology, OBGYN, where the benefits of 3D are really clear.
Okay. And is it integrating into workflows already?
It seems so. The report suggests DISP-style systems are finding roles in things like providing real-time imaging during robot-assisted surgery.
Guiding the robot.
Right. Feeding data into AI systems for triage, maybe flagging urgent cases faster, and that portability aspect makes them good candidates for expanding diagnostics into rural clinics or lower resource settings.
Bringing advanced imaging to more places. Cool. And the really long-term view. What are the next frontiers the report envisions?
It lists several exciting future directions. One is deeper integration with AR/VR augmented or virtual reality.
How would that work?
Imagine a surgeon wearing AR glasses and seeing the live 3D ultrasound volume overlaid directly onto the patient's body during an operation, like X-ray vision, but with ultrasound.
Whoa. Okay, that's a heads-up display for surgery.
Pretty much. Another area is multimodal fusion, combining the real-time DISP data with, say, a preoperative MRI or CT scan, fusing them together for an even richer picture for planning or diagnosis.
Merging the strengths of different tools.
Exactly. Then there's more automated diagnostics, using AI not just to enhance images, but to actually perform initial reads, maybe automatically detecting certain conditions to help prioritize workflow, AI triage, essentially.
Speeding things up, handling volume.
Right. And finally, continued miniaturization, making these advanced 3D arrays small enough to be embedded into other medical tools like endoscopes or catheters.
So you could do 3D ultrasound from inside the body?
That's the idea, for minimally invasive procedures or internal diagnostics.
Okay. Wow. We have really covered a lot of ground here, from the basic physics of controlling frequency and phase
Yeah, the core
to
engineering.
those incredible volume imaging speeds, the applications across so many medical fields.
Cardiology, oncology, neuro.
Right. And then touching on the really cutting-edge stuff like photoacoustics, wearables, even quantum probes.
Feels like we went from current practice to sci-fi pretty quick.
We did. And we compared it, looked at its unique spot compared to other imaging, and the challenge is still ahead.
Yeah, I think the big takeaway from this report, the core insight, is really how DSP is managing to blend these different elements: the frequency agility, the phase control focusing, the fast volume capture, and now AI.
Putting them all together.
Right. And by doing that, it's fundamentally pushing what non-invasive imaging can do. It's bringing that real-time, high-res, deep 3D capability.
Out of the realm of just MRI CT.
Exactly. Bringing it towards potentially more portable, safer, maybe more cost-effective applications. It really feels like it's bridging diagnostic gaps and could genuinely reshape how some clinical pathways work.
A potentially transformative technology, then.
That seems to be the argument, and it does leave you with an interesting thought. As this technology matures, gets potentially more portable, maybe cheaper than the alternatives, and incorporates more automation through AI, how much could that really change access to advanced diagnostic imaging, especially in parts of the world or even underserved communities closer to home where getting an MRI or CT scan is just, not feasible? Could this bring high-end diagnostics to more people?
That is a really powerful question to end on. The potential impact on global health equity. Food for thought.
Yeah.
Well, thank you for joining us on this deep dive into what really feels like the future of ultrasound imaging.
My pleasure.
We hope you, our listeners, feel a bit more informed, maybe got a glimpse of the possibilities, and perhaps are even a little inspired by where this technology might take us.